advocates from across the country are in DC this week for Rare Disease Week. It is an impactful multi-day event that empowers participants with the knowledge and tools to advocate for meaningful policy changes affecting the rare disease community.
And our first guest today is a breast cancer survivor who turned her experience with the healthcare system into a mission to help others. Jessica Baladad is here to share tips on how to navigate the American healthcare system. Welcome back. Great to see you.
Thank you so much for having me. I love being here with y'all.
We love to have you. Tell us a little bit more about your story and Patience Rising.
I was diagnosed with breast cancer at 33 years old, and my first bill was $20,000.
Oh my.
After a breast biopsy. And I thought, so this is how people go bankrupt during a major medical crisis. I wanted to be part of the solution, so I joined with Patience Rising. They're the leading grassroots organization that focuses on patient-centered legislation for more accessibility, accountability, and transparency in our healthcare system.
Jeez. Okay, so in the beginning we talked about you're going to help us navigate this system, which just from the beginning feels confusing. What's something that people don't really know about their health insurance?
What they pay into it and what they get out of it. They struggle to pay attention to their deductibles, their out-of-pocket maxes, and when they hit those limits. Because if you overpay, you can get money back, and a lot of people don't know to ask for it. Hospitals, providers don't always tell you, hey, you're owed a refund. You have to ask about that stuff.
Yeah.
You got to be aware.
Totally. Sometimes those forms are very confusing. Now, what happens if you have an insurance denial? What advice do you have for people?
When you're facing a denial, pay attention to the dates. They're required to send you information about how to appeal the denial, and every state is different. Some states follow the federal guidelines, so pay attention to those filing dates for your appeal. Also, you want to ask about your claim file. Your claim file gives you information about the people who were involved with the decision to deny your claim. I have a friend in the breast cancer community who had a medication denied by a podiatrist. And when she saw that, she appealed it and got her medication because he was not qualified to deny her medication for that.
Oh my God. See, and some people will just be like, well, I was denied. And they move on, right? So you have to be a really big advocate for yourself. Is there a way to lower the cost of some of these medical bills, or is it is what it is when a doctor gives you that bill?
So 80% of medical bills actually contain at least one error that could cost you hundreds, if not thousands of dollars.
You said 80%?
80%.
Oh my goodness.
That's a lot. That's the majority. I know.
Yes, we got to go back and be, so you need to check
Right,
them.
so you can ask for an itemized bill. They'll give you a list of charges and billing codes that you can review and say, hey, you know, this doesn't look right to what I went through during my surgery, my procedure, my services. You can challenge those and ask questions. Another thing that you can do is ask to pay the Medicare price. The Medicare price is usually already pre-negotiated at the lowest cost point anyway, so ask if you can pay that as well. And then 80% of hospitals are nonprofits, and they're required to offer something called charity care, but they're not required to tell you about it. So call the billing department, check the website, they'll send you the forms and tell you what to do from there.
Yeah, there's just so much people don't know, and when you're sick and then these bills come, it's overwhelming, and you don't know where to start. Where can people find some resources like what you're sharing?
You can try our patient helpline at patienthelpline.org. It's run by experienced patients who have gone through the medical system who can help you hold your hand along the way. And then we have all kinds of resources about the legislative things that we're talking about at patientsrising.org as well.
Well, that's why you're here in DC, right? Because you have been advocating for this. You have an event tomorrow night that people can come to talk to you more.
Yeah, it's a free event. It's our patient raiser at Mivita on 7th Street. It starts at 5 o'clock. Free food.
The food will be out. Okay.
Free food, cash bar. Come meet us and figure out, or we'll tell you what we're all about. You know, bring a friend with you.
Get some advice. Thank you so much for all the inspiration. We're going to have to be looking at all those bills now.
For sure.
If you need help navigating your medical bills or your insurance claims, you can always go to patienthelpline.org.